Yep.
You want me to put them?
Yeah, we're starting. Hi, folks. We just went live there, buddy.
Yeah, we are live. Not only are
Oh,
we
we're on
live,
Facebook,
but we
Bonnie.
are alive.
Hi, I'm Bob Schrupp, physical therapist.
Dad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about how to stop cracking your neck or popping your neck and what you should do instead.
Sure.
And the first thing we should talk about, why is it that you should stop cracking your neck?
I don't know, Bob.
Yeah, I'm going to tell you, Brad. Well, first off, one of the things is, this is kind of a controversial thing because, sometimes it pits chiropractors versus orthopedists. But if you're having your neck cracked by a professional, a physical therapist or a chiropractor, there's no problems there.
Right.
There's a slight chance as you get older, I would say, that it could cause a stroke. I mean, it's a very slight.
Right.
It's almost inconsequential.
Mhm.
But so I maybe be a little more leery as you get older, even having your neck cracked by a chiropractor. But I'm sure that's going to cause all sorts of controversy.
Yeah, that's a
Saying
personal thing.
Yeah, it's a personal thing.
I
So,
personally won't have it done anymore.
but I've seen a lot of chiropractors even online that talk about cracking your own neck and the dangers of that. And one of the things they talk about, and I don't know if this is true or not, but over time is how it stretches out the ligaments
Mhm.
and your neck becomes a little more lax. And then now the muscles have to work harder, so they tighten up and they become painful.
Okay.
So this idea of constantly cracking your neck can lead to a painful neck. It can actually cause pain
Sure.
because your neck is becoming not as stable. So what are you going to do instead? What we're going to do is show you some gentle stretches or exercises that you can do instead of popping your neck or cracking your neck, and hopefully this will take away that urge.
Sure.
Because, that feels good to have your neck cracked. So a lot of times people are constantly doing it.
Yeah, and I don't know if it actually feels good or just you hear that cavitation, that crack, and psychologically, and that's very powerful, that psychological aspect of it.
That's very true, Brad. All right, so the first thing you're going to do when you're starting to feel that need to crack your neck, I'm going to have you do a chin tuck, Brad.
Okay.
So Brad's going to show it from the side, and I'm going to show it from the front. And what you're going to do is you're actually going to take your neck and you're going to tuck your chin back like this.
And before you do that, make sure you're in good posture.
Yeah.
Okay, because this is all about posture, which is going to be very helpful overall.
Now, when you do this, sometimes when you bring your neck back like this, now don't go down like this and don't go up like this. You're going straight back.
Right.
Now, I feel a little almost cracking when I do that, Brad, and it actually feels good to do that. So this might even relieve your need to feel that crack.
Sure.
Now, if you want to add a little more to it even, you can even take your fingers and push your chin back a little bit. Some people do it this way. They do it in the crook of their thumb, and they go back like this. And all that, one, it's correcting your posture, but two, it's starting to put your neck in a position to relieve the pain.
Right. 'Cause
So-
if your head is forward anyways, you're creating all kinds of extra stress, muscle fatigue.
Yeah, the more your neck is forward like this, the more you're going to run into problems. Yeah, I know, there's no doubt about it. I mean,
So it's a win-win stretch.
Yeah. All right, so then the next thing you're going to try is you're going to try, after you've done a few of those, and if you're still having pain or you're still having pain issues, you're going to try cervical extensions, which we call neck extensions. So now you're going to kind of get your chin back, where you were, and then you're going to work on bringing your neck back this way.
All right. So from that neutral position, then we'll go back and gently go back as far as you feel comfortable. Then you can bring it back
Right,
out.
now if you hit a painful spot, stop right there and just go back forward again.
Right.
Back, and you can do these every hour. You can do these 10 times every hour, 10, 15 times. Now, if this hurts, and a lot of people it does, they can't do it. Then Brad and I usually start with the towel then.
Sure.
So why don't you grab a towel, Brad, I'll grab a towel. So there's two ways to do this. Show them your way first, Brad.
Okay. I usually take the towel kitty corner and I go like this. It just gets in a nice cushion bundle there. Low on the neck, not up by the ears, but low on the neck. And usually,
You pull down like this, don't you?
it all depends. I guess it depends on what the results are. But just to start out with, I'll have someone do it like this. And just the bundle there, that support seems to say, oh, I've had so many people say, this feels so much better.
It does. And then this is something you can work for a long time and eventually go to without the toe.
Right, right.
But this is the intermediate step. Is
Sure,
where we're at.
yep.
So,
And you can use that to pull, and I will go up like this, you know, if you get good results, if they can go farther without any pain, and when they're done, it feels better, that's a green light.
by the way, we're gonna do all these steps first, and then we'll try to take some questions. I see there's a lot of comments already.
They're coming
Brad.
through already,
Yeah,
huh?
we appreciate you all here. We appreciate you on Facebook. You know, give us the thumbsies and the heartsies, and we'll try to.
Hard bumps.
Yeah, there you go. All right, the way I like to do it, sometimes to people, is I take the little edge on here called the self edge, and I put it along the edge right underneath my ears like this, and I pull up like this, and this is how I like to go up and down. And you can actually get different levels of the neck.
Yeah.
I can go a little bit lower, and I go real low like this, and you can work to different levels, and again, that helps starting to get that movement back that way. So let's say you do this a while, and maybe it helps, maybe it doesn't help. If it's not helping, the next thing I want you to try is this one instead then.
Okay.
If, let's say you're having pain just on one side, let's say it's on the right side,
Okay,
what you're gonna do is you're gonna do your chin tuck, and now you're gonna bend to the right. You're gonna bend to the painful side.
okay,
And what you do is you're gonna do like 10 of those again and see if that helps relieve the pain on that side. It often does. This is the one that helps me. This is the one without a doubt that because I did these, it didn't help. I started doing chin tucks and going to the right, and it just immediately started taking it away, Brad. I mean, it just worked out really good.
so the chin tuck first, and then a side bend to the painful side.
Painful side, yeah, exactly. So next one, if that doesn't help, then you can actually go chin tuck and turn to that side. So chin tuck and turn to that side.
And just one word of caution throughout all this, if you are getting some pain, tingling, or any symptoms down into the shoulder, arm, and you do these, and the pain and the symptoms get worse and go down the arm further, it's a big red light, stop right there. It's not the one for you.
Yeah, it's a stop light, it's a stop sign.
Yeah.
You're gonna wanna, if you wanna see the pain actually getting better, sometimes it even starts to travel, come up the arm, and you maybe even get a little worse up here, but it's less down here. That's a good sign there.
Right.
So,
Right.
I'll go, again, chin tuck and turn to the side of the pain. Chin tuck and turn to the side of the pain. That often really helps make the differences. So those are all the movements that you're gonna try.
Sure.
And hopefully that'll, eventually start taking away your pain so you don't feel that need to crack your neck. You can also just do those chin tucks, like I said, to help stop doing those. Now, as far as neck pain too, the other things that you might try are, you want to make some changes to your posture so you don't have that forward head posture like
Right.
this. So you're going to want to work on, one thing I'm going to show real quickly, Brad, just laying down here.
Yep.
When you're in bed, try not to be in this habit of sleeping with a bunch of pillows like this and your head's forward like this, because this is creating that bad posture all night long. So you want to have,
Right here, that neck is just all, it's flexed and out of neutral
so
position.
you want to have a thin pillow when you're sleeping on your back. If you're on your side now, that's where you can use a double pillow or two pillows. You can be right on your side, and now I'm got my neck in a neutral position again.
Right,
so-
so things are lined up.
Brad, why don't you start looking over and see if we can answer some questions here.
I'll have to walk over there.
Why don't you do that, Brad? So for every inch your head is forward, by the way, when I'm like this, that causes puts 10 more pounds of stress on the neck. So, if I'm here, I'm 10 more pounds, 20 more pounds, 30 more pounds. So you can see why those chin tucks are so important to keep you lined up. And so, any questions, Brad?
Well, but they're coming so fast.
Okay.
Identified scalens with levitators, scapula and trapezius cause globulous sensation in the throat when swallowing.
Well, a lot of times this is a good question, actually. Yeah, if your posture is bad, this throws off all your whole swallowing mechanism. So one of the things that we do with people is the first thing we do chin tucks, believe it or not, when they have trouble with swallowing, because that helps all of these things line up again.
Sure.
So, Brad?
Jeff was wondering, he said, what about this problem with pain associated when you do shoulder workouts and for exercising? So he's exercising his shoulders, and it's causing problems. So the problem is likely in the neck and the shoulder exercises, because the muscles are all connected to
Right.
that area, it's going back and forth. It's a
Yeah,
problem.
it's all about posture. The other thing is when you're lifting, sometimes you get a lot of stress on the neck. You know what I mean?
Sure.
It's, you know, I've noticed that when all these muscles tighten up, it clamps down on the neck. So
Right.
it's just, it's gonna be all about posture. I mean, it really is.
Why don't you grab the white thing and show them two things you should not do for sure, that were behind the neck, either the military press behind the neck
Yeah.
or the lat pulls going down.
Well, I don't mind the lat pulls going down. I definitely wouldn't be doing any of these shoulder presses.
Pulling down the lat pull, you still gotta get your head out.
Oh,
of the
I
way,
see what
you
you're
know I
saying.
mean?
Yeah, you're right. Yeah, I mean, he's talking about pull downs here. If you pull down like this, your head has to go forward. I got you, right?
Yeah.
Yeah, you're right. So even if you can do pull-ups, I would do pull-ups in front of the bar and pull downs in front of the bar,
Right.
which are really good for the shoulder, but I wouldn't do any press ups like this. I know people are gonna maybe dispute that, but
Yeah.
we see so many people that end up with shoulder problems because they're doing press ups like this. So, any questions from Facebook, Lonnie?
There's, this Kristen Filio, she said, Bob, the thinnest edge of fabric is called selvage.
Salvage.
No F in there.
Did I say F? Did I say selfage?
Yeah.
Salvage. Thank you. Boy, she knows what she's talking about. Wow, we appreciate that we have an intelligent audience.
Teresa's wondering about pain from whiplash. Is it, no, that's got kind of a different category from what we're showing, what you said.
I can tell you with whiplash, one of the main things you want to do with whiplash, besides, you know, trying to keep I mean, you may even have to wear a collar for a while, but is isometric strengthening, Brad. That's the big thing that you want to start.
And we do have
Yeah.
a video on.
We do have a video on that if you type in whiplash, but you know, the strengthening without moving the neck. So you're gonna go ahead and you can actually use a towel for this too, but I'm gonna work on pushing into flexion. So if my hand was in here, my head would go forward like this. You know, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can do repetitions of 10. You can work back like this, push back. So again, if the towel wasn't there, I'd be going back like this. You can go side to side. You can get a towel like this and push one direction and the other direction. It's all about isometrics. Unfortunately, with whiplash, it can take a long time to get over. It's a real bummer, but do the isometric strengthening. Brad, any others?
They're coming so fast and go by, I have a hard time keeping up.
You can pull them down.
Yeah, you can.
So did Bob and Brad do a towel exercise to pull down shoulder?
To pull down the shoulder, I'm not sure what they mean by pull down the shoulder. I'm not sure what they mean by that. One of the shoulder exercises we do is a mulligan technique where we actually, you know, usually it's on a higher surface. Oh, can you bring the chair over real quick, Fred? This kind of puts the shoulder down into position. You push down on the arm while you're walking back like this. And then you keep pushing down as you walk forward again. So I'm pushing down the whole time. This sets the shoulder down into position to where it should be. And especially like with impingement and stuff like that, it really works well for generally about 50% of our patients really like it and think it really does give them some benefit.
There was one question about why chiropractors crack your neck if it's bad for you, but there's a misunderstanding.
No, it's not bad for you to have your neck cracked for you by a professional.
Someone that knows
Yeah.
exactly what they're doing.
The only thing that we were leery of is that as you get older, if you're in your 60s or 70s and your arteries are a little more susceptible, I don't know that I would have my neck cracked at that point.
Right.
You could tear an artery and it could cause a stroke.
Sure.
Again, very, very, very minute, part of the population.
Sure.
I mean, it's 0.00 something, I think.
Yeah.
But it is a possibility.
Sure.
So, no, I wouldn't have any hesitation to have your neck cracked by a chiropractor. So, anything else, Brad, Lonnie? Anything else on Facebook?
Is there a way to alleviate the pain?
Alleviate the pain of neck? That's what our whole video is about, I hope.
think so.
That, again, all these things should help alleviate the pain. Generally, it's a lot of times your neck is lacking some motion in one direction, and by restoring that motion, the pain
someone just said, oh, they're having problems with prolonged sitting. And again, maybe we didn't hit that posture while you're sitting is so
Yeah.
critical, that head forward posture. That's why the chin tuck we said was a good exercise to minimize that stress on your neck from this. And a lot of times people have no idea that their head is forward
Yeah,
when they're sitting unless someone who's next to them says, if they could take a picture of you and
Right.
look at that picture and you say, that's what I really look like.
people are often shocked how bad their posture is if they see it on video. I had a friend of mine, he saw himself walking on video, he ended years, and he goes, "Who's that old man?" Because he was walking all bent over.
Yeah.
I mean, it really is, what happens unfortunately over time is your body tells you that this is normal, and so this feels abnormal
Right.
to sit up.
Yeah.
Your position sense, after a while, adjusts to where you are,
Right.
and so then now it feels abnormal to be straight. And so you really need to have someone look at you
Right.
or do our posture test against the
Yeah,
wall.
we just did a video today. It won't come up for a week or so.
It'll be up in the next week.
Okay,
So-
and it shows up 5 steps on how to assess your posture and correct
It's
it.
a 5-step system, so
Exactly.
stay tuned. You're gonna go
It's
ahead.
a- It is a system, and
Yeah.
it's probably become a natural protocol for all therapists in the next generation.
Wow,
You want one question?
sure.
If I have my neck cracks on its own with normal movements, looking over to sides or diagonally, sometimes does this mean something wrong going on?
No, that's a very good question.
Yeah, it is.
Exactly. So what she's asking, he or she is
It's
asking,
Irene and.
Irene.
Irene?
Yeah.
Hi, Irene. That's a very good question. Generally, as you get older, and I'm telling you, by older, I mean, once you're age 20 and on, your neck is beginning to deteriorate. I hate to tell you this. So it's very natural to have cracking and popping in your neck as you move. If there's no pain with it, there's certainly nothing to be concerned about. But you're going to expect some pain a lot of times with motion. And that's why, again, sometimes that popping starts to decrease after you've done the stretches and the chin tucks and the rotations and all that. After a while, a lot of times things smooth out a little bit and there's less popping and cracking. So very, very normal. It'd be abnormal really if, as you get older, that you don't have some cracking in your neck. Anything, Brad?
No.
Okay, well, we'll probably wrap it up then because we've been on the air for quite a while. Thanks again, everybody, for watching. We really appreciate it on Facebook and on YouTube. And if you have any other further issues you'd like us to cover, please always put them in the comments. We may not respond to them because there's so many now,
Yeah, we're getting
but
overwhelmed.
we do look.
Right.
And we always look for ideas on what to do videos in those
Sure,
comments. So
sure.
thanks for watching.
You bet.